This question starts first with Congressman Walz. Because of rising insurance premiums, it's becoming more difficult for families to meet their medical insurance needs. Congress has looked at a number of options over the years, from systems of universal coverage, similar to the Canadian model, to options that would allow smaller employees to better afford insurance benefits for their employees, or rather employers for their employees. How do you think that Congress should address the issue of rising health care and insurance costs and the increasing number of uninsured employees, Congressman Walz?
Well, first of all, again, I reject that we would have to adopt a model from somewhere else. What happened to the American model? We can come up with the solutions ourselves. The facts are out there. We've got 47 million people uninsured, 4 million of them children. And we pay double what any other country pays, and our health outcomes are lower than they've been in other countries. That's a situation that shows we have a broken system. Now, some of us who have the luxury of having insurance, or some of us who have the luxury of living in southern Minnesota and near the Mayo Clinic, have some of the best care in the world. But we end up paying more for that because of those that get their care at the emergency room. So the first thing we need to realize is our healthcare system, first and foremost, must work for people and for small businesses. To be able to get to that, we have to do what the Mayo Clinic has done and the model that they have put out there, and that be adopted by both, I believe, in some form of framework, both our presidential candidates, that we have to get to the heart of the matter first. It has to be based on the value, the delivery of it. Getting everyone covered not only is a good moral goal for us to get to, it's good economics, because if we go to the preventative care and we get the children the immunizations they need so we don't get these developing problems, that's a good way to go. But by doing that, we also then say, if we're going to deliver this care, let's make sure we have the providers who are there to be able to deliver the care out to their patients, but let's do something the Mayo Clinic's always asked about. What's the value of the high quality of care? We have a problem in this country right now where we're rewarding payments with low outcomes, when what the Mayo Clinic does is they are able to deliver care at a high quality rate with access to people at a low cost or a good value. That model can be implemented across the country. People can have their choices and their health care.
Dr. Davis, your answer?
Well, this is a difficult one to answer in 30 seconds, but just let me say...
You have 90 seconds.
Oh, I get 90 seconds. Well, now I don't know what to do. I started doing cancer research 25 years ago. I've been involved in patient care nearly 20 years. And I say when a patient comes through the door, that patient doesn't come to me as a Democrat or Republican. This is really a nonpartisan issue. They come for help. They come to a doctor. They come to a healthcare provider, a nurse practitioner for help. And it's that relationship the patient fosters with the healthcare provider that is so important. I'm very concerned that some of the proposals that are out there are going to take away that relationship between the healthcare provider and the patient. We need to preserve choice. We need for people in this room to be able to choose who the doctor is, choose where they receive their health care. There are problems with our healthcare system, there's no question about it. Yet I will say we can look back and state that we have the greatest healthcare system in the world. We've had such increases in longevity. This is actually a good problem to have. In 1985, longevity in this country was about 73 years of age. Now, 23 years later, it's around 79 years of age. It's increased by 6 years in just that period of time. We've had the greatest increase in longevity in the past 60 years, largely fueled by the advances that have come from this country. We should be proud of it. We should be careful what we do to this system without hurting it too much. I think some of the solutions are we need more competition rather than less. We need portability of insurance, and we do need malpractice reform, just like the Chamber of Commerce supports.
And your rebuttal?
Well, I hope more competition doesn't mean more AIG and Lehman Brothers, is what I would hope in healthcare, because that's a child not getting the care they need when they have an earache. That's a parent worrying about that. The second thing is Dr. Davis, I think that needs to be very clear on this, has stated that Medicare is a burden on this country. Now, I find this somewhat ironic because Dr. Davis and I, the first time we met, Dr. Davis was in my office lobbying for increased Medicare funding to physicians. Now, you can't have it both ways in this. Either Medicare works or it doesn't work, and you don't ask for increased funding on the one side of things, on the delivery side, and not ask how do we expand health care to the rest of us. It makes good economic sense to get the preventative care, get everyone covered, make sure that it's portable. No one's talking about taking away choice, but what we're doing is we're spending more money for lower outcomes. That's bad business.
The rebuttal, Mr. Davis?
What we've said is that Medicare and Social Security are a burden for job creators, but it's very, very much a necessary burden, just like taxes are. but we should call it what it is. The entitlement programs, we need to make them more efficient. More efficient. I'm involved in a medical practice where we're constantly improving the efficacy, reducing the cost, improving the outcomes. And that's what we need to bring from private enterprise into the public sphere. And we're doing that in this country, we're doing that in this town.